let's look at what is CIN. CIN says cervical intraepithelial lesion. Here we have the epithelium. These are the basal cells, which are normal. These are the more mature stratified squamous cells. This is our basement membrane, and below that is the stroma. As we start our continuum of dysplasia, what happens is these basal cells start to proliferate. And here we have about a third of the thickness involvement, that is CIN1 or mild dysplasia. As we progress and we get more involvement, when it's 50%, we call this CIN2 or moderate dysplasia. As we get almost the entire thickness, we call this CIN3 severe dysplasia. But it's difficult to make a distinction between severe dysplasia and carcinoma in situ, so even full thickness is called CIN3. So we have CIN1, mild dysplasia, CIN2, moderate dysplasia, CIN3 is either severe dysplasia or carcinoma in situ. Now, what if things get worse? What's the next thing that's going to happen? These basal cells are going to start breaking through the basement membrane, going down into the stroma, and now we have invasive carcinoma. Remember, there are no vessels, no blood vessels in the epithelium, so as long as it is intraepithelial, there is no risk of metastasis. It's only when they go through the basement membrane. And how do you make that diagnosis? Biopsy. It's got to be a biopsy. See, your pap smear will take the cells which are shed off from the surface only. But you must do a biopsy in order to tell, is it CIN or is it invasive cancer? And if it is invasive cancer, how deep has invasion gone? Less than 3 millimeters, 3 to 5 millimeters, or over 5 millimeters. Here you can see is carcinoma in situ, full thickness, but the basement membrane is intact, stroma, no invasion. Now look here.